Dr. Gina Anderson, True Medicine founder. Today I'm talking about America's poor health. What if I told you America is one of the most medicated nations in human history? Yet statistically, we're not becoming healthier. Now think about it. We fill billions of prescriptions every year. There are medications for blood pressure, cholesterol, anxiety, reflux, pain, sleep, inflammation, depression, diabetes, and now even medications to counter the side effects of other medications. But despite all of this pharmaceutical intervention, rates of chronic illness continue to rise. But despite all of this pharmaceutical intervention, the rates of chronic illness continue to go up and up again. So we have to ask an honest question. If all these prescriptions are creating health, why are we still so sick? America spends more on healthcare than nearly any country on earth. Yet we continue to struggle with obesity, diabetes, autoimmune disease, chronic fatigue, anxiety and depression, infertility, digestive disorders, heart disease, and neurodegeneration. And perhaps most alarming, millions of Americans are now trapped in something called a polypharmacy cascade. That means taking multiple medications at the same time. Many seniors taking 5, 10, or even 15 medications daily. And here's where it gets dangerous. One drug causes a side effect. Then another drug is prescribed to treat the side effect. A blood pressure medication may create fatigue. Then a stimulant is added. A reflex medication may weaken digestion and mineral absorption. And then supplements or additional medications are added. A sleep medication creates brain fog. Then anxiety increases. Then another medication is introduced. This becomes a cascade, an overwhelming cascade. Not necessarily healing, but managing layers and layers and layers of dysfunction. Now listen carefully. I am not saying medications never save lives. Emergency medicine has done incredible things. If you are in a trauma, a crisis, infection, or acute danger, modern medicine can be miraculous. But chronic disease is different. Most chronic illness is not simply a medication deficiency. The body is often screaming for nourishment, minerals, movement, nervous system regulation, detoxification, emotional healing, proper sleep, sunlight, hydration, connection, and rest. Yet many people have never been taught how the body actually creates health. Instead, we've been trained to silence symptoms. But suppressing symptoms is not always the same as restoring function. The real tragedy is this: Americans are often living longer, but living sicker. More fatigue, more inflammation, more dependence, more medications, and less vitality. And many people now spend the final years of their life managing disease instead of truly living. So maybe the future of healthcare cannot simply be take another pill. Maybe we need to ask deeper questions. Why is the body struggling? What is missing? What overloads are present? What unresolved stress or trauma is affecting physiology? Why do we restore function instead of merely managing symptoms? Because true health is not simply the absence of symptoms. True health is resilience, energy, adaptation, recovery, and vitality. And your body was intelligently designed for that. Remember, you were built to heal. Trust the blueprint.